Dr. Paul here. We have got a rash you're just going to have to see. Hello! So nice to see you. When did this start? You don't know?
It started yesterday at nap time.
Nap time, okay.
She went down for a nap totally normal and woke up looking like this, so we thought it might be spider got into her bed.
And
or something.
where did it start?
Right on her face. So literally, she woke up looking like this, except for they didn't have the pustules. They just looked like bumps or hives.
Okay.
And she had a little patch on her tummy of just the hive-looking things, and then those went away with a dose of Benadryl. I called your office, and they said, give her Benadryl.
Okay.
Thinking it was hives.
All right. And so the part on your tummy where you had a little rash?
That actually went away.
It went away.
And that's an old bug bite.
Okay. Alrighty. And we've got a little one here on your hand right there, right? And there's a little one here with maybe a little scratch.
That's,
One there. That's the biggest one today.
Yeah, and that's really swollen.
Yep.
Yeah, you should be able to.
All right. And this is a little bit warm, a little bit swollen, red for sure. And then mostly it's on your face, isn't it? Do these hurt?
Yeah.
They do a little bit? Itch at all? A little bit? Have you seen her scratching?
She hasn't been scratching
Not
much.
too much?
No.
Okay. So, on these you can almost get the sense there's a little bit of fluid in them. Like that one right there on the cheek.
That look like little whiteheads, kind of.
Yeah, like a little whitehead. The difference between what we call in medicine a pustule or a vesicle is a pustule will have pus in it. It's more thicker, whiter kind of stuff. And a vesicle will have clear fluid in it. And it's an important distinction. Oh, thank you for showing me your hands, because one of the things I think about is hand, foot, and mouth, where you almost always will have little spots on hands, on the palm of the hand. And I don't see anything on the palm of the hands. You haven't been around anybody else that's sick? Yeah.
Other than the cough of her sister.
And sister's got a croupy cough. Yeah, one of my kids used to do that. Kind of sound like a seal, like It's like a seal. Yeah.
Silly.
I've been practicing. Many years of practice. Top of my list would be chickenpox.
Okay.
Even though it's not quite classic for vesicles, which is the clear fluid,
My fingers out of your mouth.
it could well be chickenpox.
Okay.
And so if it's chickenpox, careful, don't fall. So if it's chickenpox, it might be itchy, right? They tend to start with a little red bump, maybe like this little red bump here. And then they get fluid in them like we saw on these. And then they tend to break open because you just scratch them.
Okay.
And then you get yellow crusting.
Okay.
Once they're all crusted over, that whole process takes about a week. You're no longer contagious.
Okay.
But you're contagious from a day before the rash starts till the last one crusts over.
Okay.
It can be 7 to 10 days total. She definitely should stay away from anybody who's immunocompromised, people who are on chemotherapy, cancer patients, strong high-dose steroids for bad asthma or other.
Okay.
Other than that, just notify everybody that she may have chickenpox.
Okay.
We're not 100% sure. We can check titers later and be sure later.
Okay, and that would mean that she wouldn't need to have
She wouldn't need the vaccine because she'll be immune.
Fantastic. So let's just hope this is it.
We'll hope this is it. If let's just take an example of this arm one, and if that redness was to keep spreading, and it's hot, and it's not getting better with Benadryl or Claritin or some kind of antihistamine, then you would worry about a cellulitis, which is a bacterial infection maybe introduced by a bite or by the viral breaking the skin.
Okay.
But I think that's just a local reaction
Okay.
to the chickenpox or other virus that's cropping up.
Okay.
So anyway, hey,
Do you want to say, she can play with that book. Can you sit? Dr. Thomas wants to
Look.
talk to you.
this here, these are your fans on YouTube. Do you want to say anything to them?
Yeah.
What would you like to tell them?
I don't know.
Do you want to tell them hi?
Shall we say thanks for watching?
Yeah.
Yeah. All right.
Go ahead and say thanks for watching, Ava.
Thanks for watching.
Thanks for watching. I'm Dr. Paul.